Hello, everyone, and welcome to Heads Up, the weekly podcast of the National Headache Foundation. This is Dr. Lindsay Weitzel. I am a migraine strategist, founder of Migraine Nation, and chronic daily migraine survivor. I'm here with Dr. Vincent Martin. He is the director of the Headache and Facial Pain Center at the University of Cincinnati, and he is also the president of the National Headache Foundation. Hi, Dr. Martin. How are you tonight?
Good. How are you?
Great. So we have an exciting topic tonight. We are going to talk about Chiari Malformation. Chiari Malformation is a structural defect in the base of the skull and the cerebellum. It is interesting in that one of the most common symptoms is a headache, and it's a headache that is often made worse by things like sneezing or coughing or when you strain. So it has a few different variations, and we're going to talk with it. We're going to talk about it with Dr. Martin. So without delaying, let's ask him a few questions. Dr. Martin, let's just start with what is Chiari Malformation and how is it classified? How do we talk about it?
Well, Chiari Malformation is basically a situation where the back part of the skull is malformed and it's very small. And then at least the volume of that area in the back of the skull is very small. And the brain then herniates or sags down through the hole in the opening of the skull. And that can cause compression of the brainstem, which is a very vital part of the brain and kind of controls respirations and blood pressure and other functions as well. And can also cause compression of the cerebellum, which is the balance center of the brain. So consequently, a lot of the symptoms besides headache that you can get can be because of the brainstem compression and or compression of the cerebellum. So if you get compression of the balance center, you might be off balance. So you might veer off to one side. If you can get compression of the brainstem, you might have head pain. You might have lose consciousness, blackout. You might have double vision. So there could be a variety of different symptoms that can result from that sagging of the brain through the hole in the skull base.
Okay. So my next question is, what exactly is thought to cause the head pain when you have a Chiari Malformation?
The main thing that causes headache, or at least so is thought, is the fact that there is obstructed flow of spinal fluid. So normally there's spinal fluid production in fluid-filled spaces within the brain called the ventricles. Mm-hmm. And that spinal fluid then flows through the brain down into the space around the spinal cord. And it's that flow of spinal fluid that goes from the brain to the spinal cord that gets obstructed. And that's what's thought to cause headache. So say when someone coughs, you mentioned the fact that cough makes it worse. Oftentimes when you cough, you increase the pressures in your chest and part of the neck, and that can actually cause more spinal fluid to go up into the brain and cause increasing pressures within the brain that make headaches worse.
Okay. So what symptoms, you mentioned some of them, you mentioned there could be dizziness, maybe blurred vision. Are there any other symptoms that people with a Chiari Malformation might have?
I think we talked about most of them. I think the fact that, dizziness is just, it could be vertigo, but it also could be that something called ataxia. And that's where you'll kind of veer off to one side. So maybe you'll start walking and you might be veering off to the right or veering off to the left side. It could cause some vertigo as well. Sometimes you can get double vision with it as well, and it can compress the trigeminal nerve as well in extreme cases and cause pain. But what's interesting is the pain that's associated with Chiari's is generally in the back of the head.
Okay.
And the other important fact that I think the audience should realize is that it's not uncommon for people to have headaches that are Chiari related and to have migraines.
Okay.
The migraine seems to be more common in patients with Chiari. So if you have migraines and you have a surgery to get rid of the Chiari, it's probably not going to take care of the migraines, but it could take care of the headaches in the back of the head that are worse when you cough.
Okay. Yeah, I was my next question was actually going to be that a lot of the things you were explaining sounded like migraine, but one of the differences you just mentioned was sort of a location difference, back of the head versus side or one-sided pain. Are there any other differences that you can mention that between some of the general Chiari-related pain and a migraine?
Well, they did one study where they actually did surgery for Chiari, which is one of the treatments for Chiari malformations when the flow of spinal fluid is pretty dramatically obstructed,
Mm-hmm.
And found that the headaches in the back of the head tended to improve, but headaches in any other location did not.
Okay.
So the headaches that are going to be relieved by, say, surgery are going to be one very specific type. But location of the headaches is really important. Location and the fact that they worsen when you either cough, bear down, or sneeze is really what differentiates Chiari headaches, say, from another headache like migraine.
Okay. What age do people usually start to experience the symptoms related to a Chiari malformation?
It can occur at any age, but it can often occur during teenage years. So that it's not uncommon for patients to have symptoms of Chiari malformations in teenage years. But I've seen people in their 20s, 30s, 40s, and even 50s that get recognized for the first time.
Okay. And why is it so difficult to diagnose? It seems to me that when I meet people that have it, they did go through sort of a lengthy diagnosis process.
I think if you have a really good radiologist, or what we call neuroradiologist, that looks at the films,
Mm-hmm.
have an MRI done.
Mm-hmm.
You need to have an MRI because you're not going to usually get a good view of Chiari on just a CAT scan
Okay.
of the head. So, if there's more than 5 millimeters of sagging of the brain, then that would be diagnostic of a Chiari malformation potentially.
Okay.
So really that reading should be pretty easily made with an MRI scan by a trained neuroradiologist.
Okay. And so if people who are out there who have chronic headache and are wondering if maybe they have a Chiari malformation, if they've had an MRI done and it has not been diagnosed, can they pretty much rest assured that they probably don't have this malformation?
Well, all you need is one MRI. So
Okay.
if it's been read appropriately, then
Right.
you can pretty much know that you don't have a Chiari malformation, because that's going to be something that you've had since birth.
Okay. And can Chiari malformation be treated?
It can, but the one caveat I would say is that you first need to make sure you don't have a mimic of Chiari malformations.
Right.
So there are a couple of things that can mimic it and cause you to have surgery when you may not really need it.
Right.
One is if you have a leak of spinal fluid. So we talked about that space of spinal fluid that surrounds the spinal cord and surrounds the brain and so forth. But in the spinal cord, you can develop little leaks.
Mm-hmm.
And that spinal fluid leaks, and then the brain will start to sag down, and it will look, for all intents and purposes, like you've got a Chiari malformation. When you don't, you've got a spinal fluid leak.
Mm-hmm.
Those headaches are different. Those headaches are better when you lie down and worse when you stand up.
Right.
That's what we call orthostatic headaches. And I think we talked about that in a previous podcast as well. So that's one thing. And then the other thing that could mimic it is high pressures, high spinal fluid pressures. So those headaches would be worse when you cough, bear down, or sneeze, much like Chiari headaches.
Mm-hmm.
Worse when you bend over, worse when you lay down at night, and so forth. And sometimes those can mimic it. Many people think that you should get a spinal tap done to diagnose that, but you have to be really careful, because if you were to create a spinal fluid leak and you have Chiari, and you could actually cause more sagging of the brain if you were to induce a leak. So you really have to have people that know what they're doing if you would ever have a spinal tap with Chiari. So you have to be really careful with that. But some people think that is just part of the diagnostic workup.
Okay. Do people with Chiari malformation usually have physical limitations?
They can.
They can. Okay.
Just like any headache disorder. If you've got neurologic symptoms from brainstem compression,
Right.
in particular from the Chiari malformation, You can have difficulty walking. You can black out. You can have severe incapacitating headaches. So it's something that in its extreme form can be quite disabling.
Do these limitations continue after surgery generally, or no?
Usually people with surgery will improve for a period of time. And then for whatever reason, sometimes the symptoms can return. Maybe that's from scar tissue, building up. Maybe they're developing some obstruction of spinal fluid flow from the brain to the spine. And sometimes we don't know. In addition, sometimes there can be damage to the occipital nerves, which are the main nerves that go to the back of the head. So sometimes that can generate headaches as well. So I think that answers your question.
Yes. Does Chiari malformation run in families would be my next question. Is it genetic?
In some cases, but not at all.
Okay.
In some cases, you can see several members with Chiari malformation from the same family.
Okay. And then I'm wondering what sort of healthcare provider usually diagnoses a Chiari malformation?
It's mostly going to be either a neurologist or a neurosurgeon.
Okay.
So the neurologist in most cases would probably be the first one that diagnoses it, or even if a primary care physician had ordered an MRI, they may get the report back and it will say the MRI is consistent with the diagnosis of Chiari 1 malformation. So in some cases, it may come directly back to the primary care physician if they're the ones that ordered the test. But usually they'll refer the patient to either a neurologist or a neurosurgeon. But you have to be referred to the right type of doctor, because not all neurosurgeons are really well versed in how to manage patients with Chiari.
Okay.
And you want, if you ever were to come to surgery, which is one of the therapies for Chiari malformation, you really need to go to a center where they do this all the time and they have a lot of expertise in how to manage Chiari malformations.
Okay. Is there anything else you would like everyone to know about Chiari malformation?
Just simply that it's a very common question that comes up. Patients will often say, Dr. Martin, do I have Chiari malformations? And we'll talk about it. We'll review the MRIs and so forth. And most of the time they don't have it, but those that do need to be treated appropriately and in referral centers that have expertise in the treatment of these patients that can be very chronic and refractory at times.
Right. All right. Well, I think that's all we have to say today about Chiari malformation. So thank you for listening, and join us next week on Heads Up, the weekly podcast of the National Headache Foundation. Good night.